All right, everybody, welcome back to a very special episode of the Guns and Mental Health Podcast. I am here today with my co host, Kenny Barlow. Kenny, it's good to see you.
It's good to be seen. How are you?
Good. I'm glad you're here with me today. Jake's a little under the weather, and the rest of the team's on vacation. So, I couldn't think of a better co pilot than you. But I'm excited for our guests today. We have Gala True and Caleb Morse out of Louisiana, and you guys are doing some really fascinating things when it comes to guns and mental health and suicide prevention. But I'm going to let you two introduce yourselves so you can give your background a little bit. Why don't we start with you, Gala?
Okay, great. Thanks for having us today. We're excited to talk to you about what we're doing in Louisiana. So I'm Gala True. I am a professor at LSU School of Medicine, and I've been doing research, what I would call community engaged research in the area of suicide prevention and specifically firearm suicide prevention for a while, and working a lot with veterans and service members and their families. So excited to talk to you today about the Armory Project and some of our other work and the collaborations that Caleb and I have been on together for a while now.
So, my name is Caleb Morse. Am I loud enough, y'all?
Yeah, you sound great.
Okay. My name is Caleb Morse. I'm I think 13-year Army veteran, active duty and some National Guard time. And then I've got my own gun shop here in South Louisiana. I was doing the Armory Project before the Armory Project existed. I just kind of had a buddy who reached out and needed help. And I felt that it was the right thing to do was to pick up another soldier in need. So that's kind of how I evolved into my relationship with Gala and how we've grown and what we've done with the Armory Project and kind of developed it through over the past 5 years, give or take.
Yeah, that's really cool. And Caleb, God, so I always say this, like, I feel like in the 2A community, which I'm part of, and I've been part of since '98. It's been in my family for a few generations. I always felt like the veterans and the active duty military were on this a long time ago, but most gun people were kind of standing off to the side, like saying, "Oh, like this is something we need to pay attention to," right? But what I love about like where it came from, because I do feel, like I said, that the military, and not the military itself, not necessarily, right? But just the people that served were always very in tune to the mental health thing or helping out each other, supporting each other. But what I love about where this is going is we kind of taken that attitude and started applying it to other areas of the 2A community, because obviously vets and active duty military and first responders gravitate towards guns, right? That's a natural thing for us to do. Well, I say us, not me, but like just as us as a whole. And now we're starting to see it in the gun shops, and it's kind of I think we all realize like this isn't just a veteran thing, right? This is something we all love, the 2A, and it needs to be for everybody. But I really feel like it did start because we didn't talk about, like, I know 6 years ago in the firearms industry, we didn't really talk about guns and suicide, and it didn't go together. So what are your thoughts on that?
So I started working at a gun shop when I was 17 years old. So that had been 2000, 2001. And man, it was never addressed. We didn't talk about it. We even had an indoor range. It wasn't something that really came up. And if somebody came in and they were depressed or not the norm, a regular maybe, you just didn't address it. And then the Army, I was Army. Army does a big thing where it's constant training on all fronts, not just running and gunning and everything else, but you have all these other classes that you have to do. And suicide prevention is one of them. A number of other things, but suicide prevention is a big one. And the classes, when I first got in, were just classes. Man, it was a check in the box, and like big Army, it'll give you death by PowerPoint. And then we took it a step further. I was in a really good unit that took care of each other. And we believed mission first, soldiers always. And we believed that. And it was instilled in me, and I just wanted to develop and grow it. When I left active duty service and I came and transitioned to the National Guard, even then in the National Guard, they had the training was a check in the box. And then I worked then part-time at a gun shop, and suicide prevention, threats of violence, that kind of stuff upon others wasn't really addressed. And I've noticed over the past, it had been probably 8 years, 8 to 10 years, just this industry kind of taking a shift. And I think it's we're learning more about it. A lot of people were afraid, man, you start talking about it and it's going to plant the seeds, it's going to do all this other. And what we learned was we didn't know anything. And that engaging people and just being blunt about it, I'm very blunt about it, it's important. There's no reason to curtail it or be like, how are you feeling today? You look a little depressed. You look like, the sky's not as bright as you want it. Would you like to go smell flowers together? And the way that needs to be done is, hey, look, man, you come in here a lot, and I notice you're this kind of person. Let's go sit in the back and have a conversation. And I like that more and more shops are taking that approach. Be very direct about it.
Yeah, definitely. And so, Gala, how do you fall into this? Like, how do you get into this space?
Yeah, I mean, so I moved to Louisiana, I think it was about 8 years ago, and really noticed I was spending a lot of time with veterans and their families in their homes for another research study, and really getting to be like really friendly and really getting kind of integrated into their lives a little bit, and seeing a lot about where firearm culture fell into their lives, like the importance of firearms, kind of multi-generational, teaching kids how to handle firearms, hunting is like therapeutic, or sports shooting is being kind of therapeutic for people, and just really, firearms being a big part of people's lives. But also veterans and their families really talking to me about how they were losing people to suicide. There was risk in their own families. Many of them had lost a battle buddy or somebody close to them. And they really were very concerned about that problem, and, concerned about what was being done about it or not being done about it. And at the same time, just kind of driving all around Louisiana, seeing lots of gun shows being advertised, lots of firearm retailers, and thinking to myself, why aren't we all kind of getting together on this? Why aren't we engaging these gun stores and gun shows and families, and kind of how do we address this problem together? Because if we don't do that, I don't know how we're going to make any headway. So it kind of came out of that. And I think it sort of meets up as a bridge with what Caleb was just saying, is there is a lot of really good knowledge and research out there that is helpful when it comes to talking about mental health, how to talk to somebody, how to have the conversation. There are a lot of great resources through the Department of Veterans Affairs. There are a lot of resources for veterans and service members and their families. And then if somebody doesn't want to go to the VA, there are vet centers, there are community organizations that provide mental health resources and support, kind of to address the root causes of suicide risk, and get people the help they need and get them connected to resources. And there are those same resources out there for civilians. But a lot of times people are not getting connected to them, or it's such a maze. It's so overwhelming and stressful when you're already in a bad place. It's super stressful to try to figure out how to navigate those bureaucracies or find the help that you need. And so who's better to do that than someone who's in a gun store, somebody like Caleb? I just look at Caleb and he's like a role model in his community. People come in there. If you've ever been in his shop, there's coffee, there's places to sit, there's places to hang out. It's very welcoming. There's lots of cool things for sale, besides just firearms, and accessories. And people are hanging out there all day. Like they're in there hanging out, doing their Christmas shopping, talking to each other, talking to Caleb and his staff. So, it's a very natural place for these kinds of conversations to come up, and for these resources to be offered in a way that's not threatening to people. So it's just kind of bringing all that we have in the research community or in the public health community or from the VA or, service organizations in the community, bringing that stuff to Caleb and his staff and saying, like, here's some tools in your hands for you to help people when you see them in need, just seemed like a really natural connection. And it has turned out that way. I know we're probably going to talk about this more, but I'll just say, like, I've seen Caleb and his staff connect people to resources they need, and save lives through the work that they're doing through the Armory Project. So it's a natural connection, and you just kind of had to like reach across and make it, through relationships.
I had
So
Yeah.
it's interesting that you say that. I'm sorry, Mike, if that's
no,
the
go
right.
ahead. Go
I
ahead,
have
Kenny.
a comment on, and then a follow up question. It's actually interesting because that you mentioned how Caleb's got his shop structured where it's designed for people to actually stay instead of get. I was just in a gun shop 2 days ago, first time in a long time, and it dawned on me when you said that gun shops are not designed for people to stick around. And you talk to any first time, anybody, any gun owner who's had that, they all have that same first time gun buying experience. They go in, the person at the counter is cold. You're viewed as an outsider. They're at least this is the old. This was when I got involved and Mike got involved. This was our experience because we got involved at a younger age, and that certainly has pivoted. But they all have the same experience where you were afraid to ask questions, and women gun owners will say the same thing. They'll say, I was afraid to ask questions. Because there's an information disparity, knowledge disparity, and then there is no hospitality. There is no place to sit. There is no coffee waiting for you or anything like that. So that is actually fascinating to hear that that's how your shop's set up, Caleb. Is that it's designed to stay, because that, like I said, that there's the only reason that a gun shop is set up for you to stay is if they have a range, really, and there's no real seating or anything like that. So that's actually awesome. I do have a question though. When you got started, what were you noticing were the reasons for the gap? I'm not going to call it a divide between guns and mental health, or gun owners and suicide prevention, because to call it a divide would be that there was, it feels like saying that there was a divide between gun owners and saying, oh, I would be hard pressed to find a gun owner that is like fine with suicide. It's like, I don't, it's not a concern. It's, I'm sure it is a concern. They just don't think about it. What were the reasons that you were seeing as there being a gap between these two things?
And I can answer from my perspective, and then I'd love to hear what Caleb thinks. I think that's a great question. You know, I think it's a few things. I think it's that kind of, from the research or public health side, it's that kind of ivory tower mentality of like, I'm not going to get out of my office and go to people where they are. Like, that's not part of my job. Honestly, the job can be structured that way. You're not encouraged to get out of your office and go out into the community and spend a lot of time building relationships. I think that the work Caleb and I do together is all about relationships and building trust. And that's kind of not necessarily part of the job of a public health person or a researcher. So you have to get out of that mindset, and there has to be some encouragement from our side of things to go out and meet people where they're at and spend time in their spaces. And that's something that I've tried to do. Gone out and visited Caleb and spent time, and he invites me to things all the time, and I go when I can. So that's one thing. I think the other thing could be about language. So, for example, in suicide prevention, in public health, and in clinical settings with doctors and healthcare providers, the term lethal means safety is what gets used, to talk about putting time and distance between a person who's in a mental health crisis and like a loaded firearm. And if you go around talking to people about lethal means safety, I learned quickly they don't know what that means. Doesn't mean anything to the average person. It's kind of a strange term. And in fact, a lot of firearm owners I met actually interpreted as like lethal equals safety. Like, I've got my lethal firearm and that makes me more safe. And so it wasn't really resonating with that kind of suicide prevention messaging. So it was just learning how to adopt the right language and say things like secure firearm storage. I don't even say the word safe firearm storage, because a lot of people feel like they're storing their firearms safely and they feel safe around their firearms. So it's just like the language and being really careful and thoughtful about it. Another term that gets used in public health, and I think we're getting away from that, is means restriction, which means like restricting a person's access to lethal means when they're in a mental health crisis. But if you think about concerns, and this is about trust and building trust, if you think about concerns that firearm owners have about people trying to take away their firearms or restrict their access to firearms, especially when they're going through or have gone through mental health issues, If you use the term means restriction, like that's like waving a flag that says like, yeah, you should definitely be concerned about this. So it's just learning those things, really being thoughtful and intentional about language, because I think you really need to build trust and common purpose and meaning. And that's what I think Caleb and I and others have been able to do. So that's my answer. And I'd love to hear what Caleb thinks.
So the way I view it is, I mean, we all have vehicles, right? Nobody rides a bicycle to work. So
I wish.
we all have vehicles. So how often do you check the air pressure in your tires? How often do you check the tread wear in your tires? How often do you go and you make sure that your bumpers are intact, right? If it's not what you do, a tire shop will check that every day. If it's not what you do, it's not on the forefront of your mind. So for most gun shop employees and gun shop workers, to them, it's a hobby, sometimes a little bit more than a hobby, but most of your gun shop employees are hobbyists. If you understand the lifestyle and you understand that the firearm is the tool and the man or woman is the weapon, then you understand what is involved with that. And I say the weapon, but I mean, that's the way I think about it on my end. But then you understand that everything works in unison. So if the mind is right, if the heart is right, if the body's in shape, you have to have all these personal, physical things involved with you in order to be able to use the firearm properly in whatever application you're using it, be it target shooting, all that. PRS, NRL, USDP, IPSC, all this other stuff, 3-gun. You are the one that is the driving force, and the firearm is just the tool. So that's why I think we look at it differently. One, everyone at my shop, including my wife, is a veteran. So we understand a lot of the training that goes behind it, what goes in it. And 90% of our customers become phenomenal friends. I mean, we have a pretty good customer base, and we're driven by customer service. It is not uncommon to have customers call us after hours, text us or whatever, and ask us advice or other things when they're in other shops. And if I truly care about them as a person, if I truly care about the industry beyond my four walls, then I'm going to help that customer. I'd rather them not do it after hours because I need time with my family, but I'm going to help them. And that's the way we bridge that, because all too often our thought process stops right here, because once we're done with it, we're done.
Yeah, it's so I got into the space, and one of the things that what I love about what you two do is when I heard about the project, to me, it was one of the few projects that I felt like, oh, it's very similar to Walk the Talk America, even though we're not doing the exact same thing, but it's the same attitude, right? It's this attitude of kind of like, whatever it is, whatever obstacles in the way of getting people resources to stay alive, I'm going to figure a way to get around it. And I don't really care about the whole, like, well, you can't trust mental health or these people. And well, what if this happens? Okay, well, if this happens, then let's do this, right? When we talk about some of the legislation like that, I think is really cool that you guys have been behind to take away the barriers to entry. But when I heard about it, obviously I was super excited. And what makes me excited is just because like I kind of relate to it, right? I'm like, these are the challenges. I remember when I first started Walk the Talk America, and I was getting phone calls from all sorts of people that worked in healthcare and suicide prevention and coalitions and things like that. And it was really interesting because they were like, hey, I just want to help, but I'm terrified of guns and I don't know how to go into this local gun shop and talk to these people. So I remember like in the beginning, I was like writing scripts for these people. And I was saying like, let's be super intentional and honest, right? Like there's nothing wrong with walking in a gun shop and just saying, look, I'm not a gun person. I'm not going to sit here and try to pretend so you eat me alive, but I want you to know that I have this over here. And if you ever have people that are in need, right? Like, and that's really what I love about it. But let's get into kind of just some of the I'm thinking of this particular legislation when I first heard about this, I was like, that is so smart. Like and you did it. You got this passed, but basically it took away a barrier to entry for shops in Louisiana to participate in holding people's guns during a crisis. But I'll let you take it from there, because I really think the story of how that, even when the way you tell it, Gala, like, where it's kind of like, yeah, we almost didn't know it could, you know what I mean? It was almost too easy, but it's like, this is the type of stuff we need to do to move forward.
Yeah. Caleb, do you want to talk about it first, or do you want me to take this first?
I'll go first, and then you can follow up with it, because you'll have more of the background information on it. So to preface it, when I was holding firearms for a friend and other veterans before there was any legislation, and I went talk to my lawyer, and I'm like, look, man, this is what I'm doing. Guys are coming in and they're in tough spots, and I'm holding their firearms for them, and I'm giving them back whenever they say they're good. And he's like, you're doing what? And I'm like, yeah, man, I'm trying to help, and this is what I think. He goes, no, man, you can lose everything. Like, you're open to so much liability. I'm like, what liability am I opening myself up to? And he goes, well, the law doesn't really say it's there, but there's a lot of implied liability. I was like, well, look, if someone's going to sue me because I tried to save their son or daughter's life, then okay. And it goes into a mantra that I started that I don't recommend anyone do. But my mantra is, I am somebody, I am someone. So as anyone, you've all heard the saying, somebody should do something, someone should do something. Well, I am somebody, I am someone. So anywhere I am, if someone says somebody should do something, that's me. And it's put me in a lot of uncomfortable situations, but that's what I do. So I applied that to this and started working forward with it and going with it. And then when Gala and I started talking about what was going on and what I was doing and what the shop was doing, and we started trying to grow the Armory Project, the biggest fear that every shop had was, well, I can lose my license. I can get sued. They can shut me down in a heartbeat. And I've lost my livelihood, my passion, my ability to own guns, everything. And I was like, I get it, but it's a worthy cause. And thankfully, through Gala and all her connections and a few of my connections and just the right people at the right time, we were able to get a law passed in Louisiana where they stripped and removed any implied liability for trying to help someone out as a gun shop, trying to help someone out and hold their firearms for them.
Yeah, it's just brilliant. And that's what I love. And it almost seemed like and you're going to get to the background of this, but like it's one of those things where it reminds me of, and once again, I'm going to compare this project to WTTA. It's like when I was asking gun manufacturers to put the free and anonymous mental health screenings in the box, and some of the immediate responses were like, yeah, we could easily do that. And it was like, it was that easy. Like all I had to do was ask. It's like all I had to do was put it in motion. But yeah, I totally hear what you're saying, Caleb. And one of the things that used to crack me up, because I was always promoting safe storage with gun shops from day one. Like that was one of the first ideas that we had. And then we realized taking it on a national level was just going to be a monster. But I remember I would be talking to gun shop owners, and they were like, what if I give them their guns back too soon and they do something horrible and then they sue me? And I remember I would always ask one question, and it was like watching their computer just malfunction. I would always go, well, what if you don't take their guns and their family comes back and sues you because they came to you for help and you didn't take their guns? And it was really funny because it was such a conversation ender, because they were just like okay, I'm moving on. Like, but I always thought, like, what is the way around that? And it seems so simple, but now when I look at what you guys did, it was like, that was the answer. The answer was right there. Let's just go get legislation to give some people some protection and make them feel comfortable about joining this. But if you want to get into the background, Gal, I'd love to hear it. So.
Love that. I mean, I think it's funny because I think it feeds into something maybe you said a while back, Mike, about kind of like the working together and I think Kenny brought up like that, bridging that divide. I mean, I think that what we found was that when the right people come together at the right time, like it's so kind of powerful. It sort of slices through anything. And that's kind of how I think it happened. Yeah, so we wanted to partner with firearm retailers to give them, training and tools, so that they could be talking about secure firearm storage to their customers, and most importantly, could provide out of home storage for somebody who was in need and needed to temporarily get their firearms out of their house. Um, and Caleb was already doing it. And he was already doing it, like he said, with kind of no infrastructure and no cover, no support. And Caleb and a couple of other firearm retailers came together and agreed to help develop the Armory Project with us so that we could kind of figure out, work through all the barriers, and then be able to hopefully grow it across the state. And right away, the biggest barrier that came up was this one about civil liability. And what would happen if an FFL returned someone's firearms to them and then the person subsequently harmed themselves or someone else? And it just seemed like kind of so obvious. Well, there needs to be like what we were thinking of as a good Samaritan law, which is like if you stop to help somebody and something goes wrong, you still did the right thing and you shouldn't kind of lose everything or be penalized for trying to help. But so we looked and there was no law like that. We were thinking, well, there must be a law like that somewhere in some state that we could just kind of piggyback onto. We couldn't find anything. And so a bunch of people who were working together started talking about, well, what would this look like? And it seemed like it could be pretty simple. It could just say, if a firearm retailer temporarily stores firearms for someone, and then gives them back to them, as long as they follow the law, when they give the firearms back, they should be immune from civil liability. And, so it's kind of like we had like the general language. And then I think I can't honestly, like, I'm trying to remember some of the details, but essentially 2 legislators in the state were really interested, and they were kind of across the aisle from each other, but could get together on this. I think it was seen as sort of being a no-brainer, not just no concern about it. Like, this is a good idea. This is going to save lives. This is for suicide prevention. And so I think like keeping it very narrow and very focused was the key from that point of view. The point of view of the legislators is like, don't layer anything onto it, but just keep it really simple and focused on suicide prevention. But also, it doesn't say anything in the legislation about suicide or mental health, because there could be lots of different reasons why somebody might want to store their firearms. And also, if you just kind of put that in there, like, people who are going to Caleb for the Armory Project or to other firearm retailers, they don't have to say that this is because of mental health. They don't have to disclose that when they're asking to have their firearms stored. We're hoping that they will, so that they'll get maybe referred to some resources or get that relief of knowing that they disclosed their troubles to somebody and somebody cared about them. But it's not required, because we don't want to take away that option of somebody just kind of keeping that private and saying, hey, I just need to temporarily get the firearms out of the house right now. No questions asked. So yeah, the legislation language is very, very simple, very straightforward. And it really just passed through the House and the state very cleanly and was signed by the governor. And I think one of the powerful things was that Caleb was there to testify on behalf of the legislation and to say, look, I'm a firearm retailer. I'm doing this already, but a major concern is that I could be risking it all with my business, in trying to help people. And so if this legislation passes, it's going to take away that barrier to a firearm retailer helping somebody. And I think that was very powerful. There was a veteran there who was willing to testify, who had used the service and was willing to testify and say, like, this is something that made a difference in my life. And it wasn't even necessary. They were just like, we don't need to hear from anybody else, like, passed unanimously and was signed into law. So now I think it's a model for other states. And I know there are other states who are interested in passing legislation like this. I think Montana recently passed some similar legislation, and we're hoping to see this in other states. So I think it made a big difference, and it kind of shows the power of when you come together, and kind of find common cause, you have the power to be able to do things like this. Because I was surprised. I really was surprised that it passed so easily.
Yeah, it blew my mind because Gal and I have been talking about it and we've been preparing for it for like weeks. And I don't know if you had a better understanding about how our government works, but I didn't understand what it meant to get a bill passed. I had an idea about the process because I used to sing the songs as a kid from TV,
It's
and I go there and we sit down and we testify. And legitimately, there was one question asked of me, and it was from East Louisiana, a representative there. And he said his lifelong dream was to have a beard like ZZ Top. And my beard was probably 6 inches longer. And he's like, how'd you grow that? And that was the only question asked of me about anything. And I didn't know how to respond. So I just laughed. And that was it. And next thing we know, the bill becomes law. I've never seen that before.
Did you feel like there was anybody as the 2A crowd, right? Like we're very aware sometimes, like at least I know I am. Like I walk and I speak in front of crowds, and there are times when I can like look at somebody, I'm like, that person doesn't like me, and they don't like me simply because I work in firearms, right? Like, did you get it? Was there any of that feeling?
No, so Caleb, I remember two things, and maybe correct me if I'm remembering any of this wrong. The one I remember clearly is that I did go, this was during COVID times that a lot of this stuff was going on. So there were a lot of virtual things. And the group Moms Demand Action in Louisiana was having virtual meetings. And I got on their agenda and went and presented to them about the Armory Project and the upcoming legislation, just to kind of see if they had any concerns about it, or if they were going to, they have legislation that they're watching. And because it's Louisiana, a lot of the people in Moms Demand Action are firearm owners themselves and 2A people, but kind of like walking both sides of like being advocates for trying to prevent deaths, firearm deaths, but at the same time, like being kind of firearm owners themselves. Anyway, they had a lot of, they were very supportive. Some of them had lost someone to firearm suicide themselves and really didn't want to see anybody else go that way. And so they were like, look, this seems really necessary. They love the Armory Project. And they said, if this legislation is going to help, these FFLs support the Armory Project, then we're all for it. That was one thing. And then I think, Caleb, didn't you run it by somebody who was like a 2A? I'm trying to remember. I feel like you ran it by somebody
I
who's
ran
like
it
a 2A
by
law.
the Gun
Yeah.
Owners of America. I ran it by the NRA. I ran it by the Louisiana Gun Owners Association. I ran it by another FFL group that I'm part of. And everyone's concern really on our end was, well, how do we get people to utilize the system? Because their thing was, okay, well, if this is going to remove the stigma and the liability from the gun shop, how do we get it utilized? I'm like, man, all I can tell you is the first step in a mile is the hardest, and this mile is going to be 100 miles long, right? And I really met no opposition on anyone that I talked to about it. And still to this day, the only concern that anyone ever has is the people using it. And it's they're like, well, how do I know you're going to give me my gun back? And I have a contract. And in my contract, it says, I'm going to give you your firearm back. And look, I want you to get mental help. I want you to make sure you're in a better spot. If you have a drug and alcohol problem, I want you to get that taken care of too. And I plug people in to people that I know that can help them because we want them to get that help. If they don't want me to, I'm not going to do it, but I'm going to help where I can. But I want to give you your firearms back. I'm not going to try to backdoor you, steal them, and sell them. That's not the kind of human being I am. And I put it in paper. I put it in paper. This is the kind of man that I am. This is the kind of business that I own. And I want you to have your firearms back.
Yeah, I just gonna, if it's okay, I'm gonna piggyback off that for a second, Caleb. That is the main question that people ask, both the firearm retailers who join the Armory Project and potential customers who might be using it. is always like, well, how's the person going to get their firearms back? And what happens if for some reason they don't pass a background check when they go to get their firearms back? Because there are two ways. I don't know if we want to get into the weeds on this, but I guess there are at least three ways that somebody can temporarily store their firearms at a firearm retailer. One is the one that's been kind of um, given like a little stamp of approval by the ATF, I would say, in that this open letter that they published. And that would be if the firearm retailer had lockers that were available in kind of the floor space of the store, and a customer could come in, store their firearms there, put their own lock on it, and the retailer doesn't have access to it because the owner has put the lock on. We've heard a lot of feedback from retailers that that's probably the least desirable option for them, because using up floor space is like losing money for them. And a lot of them are on a thin margin in terms of their profits. And so giving up that floor space is tough. There also, I guess, could be some issues with safety, like concerns about the store getting broken into, and those lockers being able to be breached, whereas the space that's in the back might be more secured or stronger cabinets. And from the point of view of mental health and suicide prevention, that's maybe a less desirable option. Like, you could look at it like the pro of it is that the person doesn't have to say anything about their mental health struggles, doesn't have to talk to anybody, can just go in and store the firearms. And so they are getting them out of the house. But maybe the con is that they're not really talking to anybody, they're not opening up to anybody, and they're not getting connected to any resources, which is part of what we're trying to do. So anyway, that's one option. The second option is a gunsmithing and cleaning. Someone can bring their firearms in to get some gunsmithing and cleaning. They're typically leaving them. It's still got to go in a book, right? You'll say which one, Caleb, but it's still got to go in a book if it's left more than 24 hours. But when the person comes back to get them, they don't have to do a background check. And Caleb, I know you're going to jump in and sort of add to this, but I'll just say quickly, the third option is a temporary storage hold, which Caleb is talking about, where the person they'll have to pass a background check when they come back to get their firearms. And there is the chance they won't pass it. And we can talk in a minute. We actually try to come up with some contingencies and SOPs and things like that about what to do in that case, so that both the retailer and the firearm owner feel like they're covering the bases as much as possible, to be transparent about that and have a conversation about that. But I'm going to hold there because I can see Caleb has something to add, and then we can talk a little bit about how we talk about that being handled within the Armory Project.
Yeah, and like she was saying, the ATF sent out an open letter about having storage lockers. And in retail, square footage is dollars. I understand that mindset. I don't adhere to it because I like open space. It encourages people to walk. I have stools and benches and bars set up for people to sit at, because I find that the community engagement is worth more than a higher profit margin. But we take them in either on repair, so it goes in the gunsmithing bound book. And while it's here, I hold them for up to a year. And I legitimately gunsmith them. I will clean them. I will repair them. I will make sure everything's done. And we legitimately work on your firearms. And if you take it in on the gunsmithing side for repair, you legally have to. So we do that at no charge to the customer. Understand that federal law already accounts for that. Let's say you're having thoughts of suicide, or someone in your family is, or maybe you're concerned about them. You can bring their firearms to the police department, and the police department will hold them. Depending on law, they can hold them for up to 90 days, and then they become the property of the agency, and they don't legally have to give them back. They're also not maintaining them during that time. So that's why I like doing the repair aspect of it, because I'm going to maintain your firearms. And to date, every firearm I've taken in on repair has left my shop in better condition than it came in. The other is a consignment hold. The consignment hold, we have a discussion up front. Look, this is what's going on in your life. This is where you are. If you think you may want to sell this eventually, or you want to transfer ownership to someone else in your family, we take it on a consignment hold, because then the thought process is someone else may possess this firearm. And in my contract, we lay out, John Smith, you're going to give this to Jane Doe if you don't come pick it up. She has your written permission. I have a copy of the driver's license, all this that says she can come get it, or whoever it is. And if whoever it is, when I take it on a consignment hold, a 4473 must be done legally. And then we do the 4473 and it goes to live at whatever household that was agreed upon. But that's the end goal to this is I don't want it on my bound books for a year. I want it to go back to the owner because I'm holding over 100 firearms right now. And some of these are generational firearms. I want someone else's son, someone else's daughter, someone else's grandchild to have the same joy that I've had growing up, that they had growing up, and keep these firearms in your family. Because it means something to me to have these firearms that are passed down generationally and to continue the traditions that our forefathers had.
Yeah, that's awesome. One of the things I want to add here, because we might have some gun shop owners listening to this or people tuning into this because they're curious about getting involved. Even if you never hold one gun for somebody, right? Which would be, we want to think that's the greatest scenario, right? Like everybody's mentally healthy. The importance of our people, the 2A crowd, literally saying, we got you. Not those people over there, right? Like they say they got you. We have you here. Like this is where you can come to talk about these things in a safe space because we're all gun people here. That almost is just as important, right? That it's offered. That it's like if I go into a gun shop and I'm like, I bought this firearm from this shop and they were really cool, but it also seemed like they really cared about me. You know what I mean? Like it also seems like they want me to be mentally healthy and they want that part built into my gun ownership plan, right? Like we understand safety, we understand what happens in a defensive shooting. And now we also understand that we have a place to go, that if we don't feel good, crisis is temporary. They understand that. And I think it's really cool that they're saying it's okay, come here, we'll get you the resources. We'll get you help any way you need it to stay alive, right? Which is the most important thing. So I don't want any person who's listening to this to underestimate the power of that as well. Because I think what happens, and I know, Gala, we've talked about this before. It's just like if a shop signs up and they expect like the floodgates to open because they want to just do good and they feel like they're going to be helping people, you are helping people. You are helping people by simply saying that this exists within your shop, and you could come here. It's okay. Like everyone's allowed to have a bad day. Let's do the right thing and keep people healthy. So I just wanted to. I know you want to get back into the weeds of it, but I wanted to throw that out there too. Do it right. Like that, the more the 2A community comes forward and we build our own programs and lead by example, the less we will have to fight off other people's programs that are going to be bestowed upon us or by government and things like that. So that's why it's important.
Yeah, I just 1,000%. And I think we do try to say like success. So in research or in funding or when people are asking about this program, they're always asking for numbers, like how many firearms have been stored, et cetera. And to me, that's not the metric of success. The metric of success is, are we changing the conversation and are we putting power and knowledge in the hands of the people who need it, which are people out in the community who talk to each other. People learn through word of mouth. They go and confide in a friend about something or a family member or, somebody they're talking to like Caleb. If we don't get kind of the knowledge about how to have these conversations about mental health and the role of firearms and suicide, how many suicides involved a firearm and how are we going to prevent those suicides, if we don't put that knowledge and the ability to talk about it in the hands of people like you guys, Caleb, Caleb's staff are amazing. I've been to other gun stores where all the staff are veterans, have worked as first responders, worked in law enforcement. They've got networks of family and friends and people who this is like rippling out. So they're having these conversations in their social networks and changing the conversation. It's much harder to measure that. It's much harder to measure, like, how are you changing the conversation? But I think that's really the biggest thing we're doing. And so you can count like number of firearms that have been stored, but to me, that wouldn't be getting at what we're trying to do here. What we're trying to do here is like change people's knowledge, make them feel confident, and have some competency about having these conversations, make connections between people in mental health fields, therapists. Like I know one of the things you guys do, Mike, is you have like therapists who are culturally competent. You train them in having conversations about firearms with their patients. Like those are all the things we're trying to do, build those bridges so that like when Caleb encounters somebody who's in need, he knows somebody at the VA or in the community who's a healthcare provider who he can connect that person to so that they can get the help they need. I think those are the things we're trying to do. And if we just only count like number of firearms stored, we're going to be really missing the point. Even though Caleb is like a magnet for helping people and actually storing firearms, but there are firearm retailers in the Armory Project who have never stored one firearm. And I tell them all the time, like, you're doing the work. Like you've got the brochures out, you've got the messaging out, your staff have been trained, you're having conversations with your customers. You know, if they're firearm instructors, they're working a lot of this into their firearms classes. Like you're doing the work. And I think we have to be careful about just making sure that we convey that message so people don't feel a lack of enthusiasm or like they haven't done what they had set out to do when they joined the Armory Project or an initiative like it. It's like, no, you're successful. Like you're doing it. What were you going to say, Caleb?
I was coughing, but what I was going to say is, in the metrics, when we try to measure things, whatever you look for, you're going to find. If we look for the metric of successful marriage, and you look at it, you're like, I don't want to get married. I've been married 20 years to the love of my life, and the only metric I care about with all of this is I remember our local sheriff department was doing an academy, and they had a guy show up late one day. Showed up late. Not didn't show up. Showed up late. And the sheriff department, one of the instructors talked to the guy and was like, let's take the day off. And they bring a veteran. He was a Marine Corps veteran. They bring this man from the academy to my shop. And they're like, hey, you should go have a cup of coffee in the back with Caleb. I'm like, hey guys, what's going on? They're like, no, we think you should just go talk to this guy. I'm like, look, I got a busy story, got all this going on. They said, Caleb, have a conversation. So I grabbed a cup of coffee, and an hour and a half, 2 hours later, this guy walked out with a different attitude. It was the anniversary of his best friend's death overseas. They were on foot patrol together, and he saw his best friend get blown up by an ID right in front of him. And the local sheriff department had enough wherewithal to say, we know somebody. And I am not a psychiatrist. I am both the best and worst advocate for the Armory Project, because I tell shops, if you want to do this, you need to think hard about it, because the mental pressure and the mental weight from it, man, it's heavy. It's not a, hey, yeah, we hold your firearms and you're going to have a great day conversation. It's never that. But in the same breath, the right people doing the right thing, man, I think I've done more for my nation doing the Armory Project than I did when I was in my service.
Kenny, you got something to say? I didn't know.
I don't.
No, absolutely. I completely understand that process. It's funny. Like I used to sell 60 to 80,000 guns a year, and I really prided myself on being like this person that upheld the Second Amendment and armed people, and then this happened, right? And now I look back at my time, I'm like, I'm super proud of what I accomplished as an importer of firearms and educating people and kind of upholding the Second Amendment to people. But the work that I've done now, it's like I'm much better at this, I think, and I'm much more proud. So it's not the same because you serve, and I commend you for that. But I that resonates with me for sure. One thing that I kind of wanted to ask Gala is, and Caleb, you're going to have opinions on this too. You're from the VA, right? There is a lot of mistrust of the VA. Have you ever encountered? You're smiling, Caleb. have you? And we're trying to bridge the gap with the VA as well. Like we've had members of the VA come on. We had Matt Miller come on. Russell Lemley, right? Like, there's two sides. There's three sides to every story, right? There's this side, there's that side, and there's the truth somewhere in the middle, right? And the VA is openly admitting that they're not perfect, but I've heard a lot of great stories, and I I see a lot of people that automatically shell up when you say like the VA because they've had those bad experiences. And I guess my question is, has that ever come into play with this
Oh,
project?
yeah. I mean, I think Caleb knows, I'm not going to use names, but there's a firearm retailer who was the first person I met with before I ever met Caleb. And I got connected to him through a veteran so all the work that we started and from the very beginning, there were veterans who were stepping up and working with us and kind of helping to inform everything we were doing. And so a veteran went to a meeting with me to introduce me to a firearm retailer that he knew. This was like the shop he goes to. The owner was a veteran and former law enforcement. And so we went to the meeting together, and I'll never forget. The guy had his office set up so that he was up really high, and there was like a couch down really low. So I'm sitting on the couch, and he's looking down on me with like it's hard to explain, but he was set up to intimidate. I felt like I was being interrogated in an interrogation room. It was intense, and he really came at me hard. By the way, I usually have a very professional environment, but I'm like working from home today, and my son just let the cat into the office. So anyway, sorry
We're
about
animal friendly on the show.
that.
Trust me.
Right.
That's not
I
the
mean,
first cat that's made an
I'm
appearance with
usually
dog.
I'm usually a lot more professionally set up. But he really came at me with everything. And it was all the bad experiences that have ever happened with the VA, all the times the VA has ever let anybody down. Why are you focused on firearms? Are you trying to take, guns away from veterans who are dealing with mental health issues? I mean, just the whole gamut. And why aren't you addressing the root causes of suicide risk? Like, why aren't you helping veterans who are dealing with legal issues and financial issues and relationship issues and mental health issues? Why are you focused on guns, firearms? And it was really intense, and I'm sure I sweated, through my clothes at that meeting, but it was so helpful because it was everything I knew. Everything I knew was going to come up, he brought up. And he really put me through my paces. And by the end, he said to me, well, I vetted you. I really have tested you, and you've kind of come through. And so now I'm going to sign on and support this. But if you had failed any of these questions, like, I'm going to kind of sink what you're doing. I'm not going to support you. And in fact, I'm going to tell other people not to support you. So yeah, I mean, I've heard it all. I agree with lots of things. The VA it's a huge bureaucracy. Not every person is going to be great. People have had bad experiences. It breaks my heart sometimes. Caleb knows, he and I have kind of gotten together around veterans who are not getting the mental health care they need or not getting the appointments they need. And it breaks my heart. And I'll do anything to try to help fix that from the inside, anything that I can do that's within my power. And I'll acknowledge it fully. But I will say that the VA is really just on the side of suicide prevention, and not just preventing suicides of veterans who use the VA, but preventing the suicide of any veteran and any family member. I always want to bring in the family members. They have access to firearms in the home, and they can be under great emotional stress and burden, and they are at risk for suicide. So, like, some surveys have shown that something like 25% of caregivers of veterans, who are providing kind of like daily help and healthcare and support and whatever, that 25% of those family caregivers have thoughts of suicide. So we got to be thinking about them too. I just would say yes, like, all the critiques are legit in lots of ways, but there are a lot of good people within the VA trying to make change from the inside. And definitely everyone on the VA is on the side of suicide prevention and not on the side of trying to take somebody's firearms away from them.
Yeah, that's the one of the things that I noticed when I first got into this space, and I remember getting the invitation to the White House to work on the prevents for the VA, the prevents team, and I remember I was at Kenny. I was at NASGW, I think. It was a week before I was going to the White House. And some people had heard that I was going up to the White House to work on the VA suicide team. And I got cornered by about 5 veterans that work in the industry now, right? Because once again, like I said in the beginning of the show, veterans naturally gravitate towards this industry, and it makes perfect sense. But they were so pissed off at the VA, and I didn't realize, I wasn't really in touch with, like, I'd always kind of heard the hate for the VA, but I didn't realize how deep it ran with some people. And I remember, like, they were I'm thinking about CJ, Kenny, like people like that. Yeah. Like that literally were like, you go up there and you tell them and da 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 da. And I was like, oh, this is great because now I'm coming with all this ammunition that I can throw at the VA and da 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 da. And I remember I went up to and I was with all the heads up and I was telling them all these situations. And like, they were like, dude, we changed that law like 2 years ago. Like it's different now. And I was like, yeah, I probably should have looked into that. But here, like, my point is that a veteran gets, or an active duty military gets scorned, right? Like they get angry and they're not coming back to check if you changed the policy. It's like a breakup, right? Like, and now what you have is you have these veterans inside the firearms community that are spreading bad information, and they're not doing it purposely, but they're basically, veterans will, they're it's like a tribe, right? Like they will start to crowd around their own, and they will say like, oh, you can't go there. Now you can only go with us. You know what I mean? Like, we'll help you. They'll never help you. And they won't go back. And I remember my thought process was, that was my biggest recommendation to the VA was, you have to get involved with the firearms industry. Like, you cannot no longer sit and say, we can't jump in there because we can't be seen with those people. I said, you cannot make us a villain anymore. And I remember this is in 2019, and they were like, we can't attend SHOT Show and we can't attend the NRA show. And I was like, okay, well, what if I pay for it? What if I pay for it? Like, it'll be vacations for you guys. Like, what if I pay for you to be there? Because I need you to come around and talk to these veterans, and you need to hear what they're saying. And because I need you there to be able to correct it if it's wrong, right? And you need to have a representative there that they could beat up at least and vent to, and they feel like they're being heard. Because I felt like it was like my friends that are in the industry that were veterans were like wounded ducks. You know what I mean? They had no voice. Like, they were just like, hey, tell them. But Caleb, what are your thoughts on that?
I've had great experiences with the VA, and I've had horrible experiences with the VA. And so what you're talking about, the veterans that kind of clump together, we always call those barracks lawyers, right? They're like, man, look, if you're not happy, the best way to get out of the Army is to get fat and fail your PT test and do that 3 times, and you're a civilian again. No, that's not the answer. So it's breaking up that bad information. And the VA needs to do a better job at community outreach, which they're doing more of that now. Because there are a lot of vets out there that they own firearms. They don't come to my shop. They don't hunt anymore. They don't do anything else. Man, they sit at home, and some of them are just miserable because they've been so scorned that they put themselves in these positions where every day is just a bad day. And you have to have that understanding of, look, man, if I have a bad day, I can fix that. Like, I can work on that. And like with us, when vets come in and they're like, look, the VA is involved. I like what you're doing, but it's involved. I'm not touching it. I'm like, well, I mean, the government's involved with your driver's license. You drove here, don't you? Well, yeah, but, I'm like, I don't trust the government. Well, yeah, but you still have a government issued ID. You get your vehicle inspected, don't you? Well, yeah, but like, no, you can't have your cake and eat it too. So the VA has minimal oversight in this. And Gala has never asked me, no one involved with this has ever asked me, hey, can you give us the name and address of who stored a firearm? And if they ever did, I would say, no, I can't. Because that data, while I have it on paper for, the contract and that end of it, so I can make sure I give firearms back to who they go to, man, I'll shred that in a heartbeat, because that's just data for me to use to help people get the right thing that they need. That's not data for government oversight. That's not a backdoor for registration. None of that. That's just me to make sure I give people their firearm back or to who they want it to. And it's getting people to understand that. And I've had vets come in that are like, man, I like what you're doing, but I'll never give up my guns. That's fine. I'm not asking you to give up anything. But if you know somebody in a tough spot, send them my way, because I want to help them.
Yeah, I think I just want to add, like, I know this kind of work that we're doing is really an effort to and this is another thing you can't measure. I don't know how you're going to measure this, but we're trying to rebuild some of the trust and the individual relationships. And so I know that like Caleb has really connected with the suicide prevention team at the VA that's near him through this work. And I think they go in and visit, and I know Caleb, they think of you when I think one time they called you when they had a veteran who was struggling and wasn't really sure what to do. They called you so that he could talk to you. So, I mean, it's just like building all this work is about relationships. And that's why we do the Armory Project the way we do. We don't just call a firearm retailer and ask them to like be on a map and then leave the map up and that's the end of the work. Like this is all about relationships and maintaining the relationship and seeing what we can do together and building on it, because all these kind of good things happen when you have a relationship. You can't, I mean, I don't know, like Caleb's a person and I'm a person. Like I don't represent the whole VA and Caleb doesn't represent the whole firearm owning community. We're two people who have built trust with each other and have each other's backs and text each other and check in about things and show up for each other. And that's really what leads to helping people. I mean, I think that's what, like, Caleb is a resource that I can't even measure. Like he's just an amazing resource for when I want to help somebody. And I hope I can be the same to him when he needs something. And that's kind of really what it's all about. And I think that hopefully, again, like I'm not saying that the VA doesn't have problems. Um, but yeah, we're not there to try to like get into what Caleb or any other firearm retailer is doing. Like that's their business, and the storage is, or the conversation or anything like that, is between them and the individual customer. The VA is just there to try to help provide some infrastructure and support so that people like Caleb aren't just doing this completely on their own. And Caleb would do this completely on his own, frankly, but there are other firearm retailers who really need, like the support and the connection and the SOPs that we write and the templates that we create and things like that. Like Caleb had his own template that he uses to talk through a customer and contract of like what they're going to be doing. But not everybody could create that or would know what to put into it. And so we created that template and make it available to people, and then they can edit it to work for their store.
And then
But that's really what we're there for.
It's great to have like Gala and the team behind me, because there are times where I'm like, man, this is a lot. I have another podcast that I host and all this other stuff, and I was recording a podcast.
What's that podcast? Give it a plug.
So it's called Implicit Bias. We talk faith, politics, and whiskey.
It's a good
all
name.
The things they tell you not to talk about, that's what we talk about. So I'm sitting there and we're recording, and my business Facebook page gets a message from a veteran who's in need. And not just like a cry for help. He's like, look, it's about to be that time, and I don't want to do this, but help me. So I'm messaging back and forth. I'm going through the whole process, and I'm like, what can I do to help this guy? What can I do to save his life? He's 30 minutes away. How can I get to him? So I reach out to Gala, and she's like, look, we can do this, this, and this. And she gives me a series of things. I'm like, all right, let me talk to him and work through the entire process. And this veteran in particular didn't want to use the Armory Project because he felt it would be better if he just got rid of them. So he ended up, I think he gave the firearm away the next day. I was going to drive to his house that night and sit down, talk to him, and have someone else come and pick up his firearms, and we'll just haul on to him and figure it all out. But he ended up having a family member come pick up all his firearms. He sat at home, and I messaged this guy till like 2:00 in the morning. And Gal and I were going back and forth all night long about this. And look, I'd love to tell you that he's in a great spot today. He's not, but he's better than he was. And that's what having this kind of network and team is about. Because if she was just a VA employee, you think she'd have answered her phone at 10:00 at night? So there's way more to this than just what's on the surface.
Yeah, it's I tell people all the time, and I'm going to compare the relationship you two have with the relationship I have with like Russell Lemley, right, who works at the VA. Russell and I, when we are together, we are on the exact same page. Russell gets it, right? Like Russell, I don't even, to be honest, I don't know if Russell even likes guns. Like I don't. Like I've never like flat out asked him like, how do you feel about firearms? But when we were working on the prevents team, like we had that special connection because he thought I was like rolling my eyes at something he was saying. I was actually like excited about what he was saying because he was trying to pass legislation that got the government to pay for lockers for gun shops, right? And I was just like, yes, okay. Once again, this guy's thinking forward, and he's not. And you know, I had talked to him about it, and he was like, yeah, you know, what do you see as the downfall? I said, well, there's going to be this mistrust, but that's something we can overcome in time, right? Like the longer something stays around and there's no anecdotal nightmare stories, the better that this gets, the easier it gets for us, right? Every year that you guys exist, it's going to get easier to get shops on because they're like, Caleb's been doing this for, you know, X amount of years and not one person. Like people need to understand that if something went wrong, like if we had a bat phone to the government and we were getting people's rights taken away in this day and age with social media, all this is over with. The Armory Project's over with. Walk the Talk America's over with. You can't survive, especially in the 2A world, if you're considered a traitor or you do something goofy or out of pocket, right? But it's I know that Russell works with a ton of people that don't understand me and my people. I work with people like the 2A crowd that doesn't understand Russell's people, right? And it's like that's why we're bridging this gap. That's why we have Russell over there, right? Because I know Russell's going to champion for everything we believe in, and I know that I'm going to give Russell what Russell's people want to see. And I'm going to go back to what you said earlier, Caleb. You said that's something. Somebody needs to do something, and that's why I love that we're doing it because it's like step aside, like let us do this, watch this. We're that something, right? Like when all you could come up with is feel good legislation and you think that's going to solve the true issue of what you call gun violence or gun death, we know that doesn't work, right? Like we need to have action items. We need to have this stuff ourselves. We need to have it. We need to be a shoulder as the industry. We need to be a shoulder to lean on, and everyone needs to understand that. I am going to go into rooms where people do not think like me. I'm going to go into rooms where they're going to love what I do, but they're also going to turn around and be like, I just wish guns would go away, or I would love to have, you know what I mean? But by me going into those rooms and showing people what we do, I know I'm going to win in the end because they're going to be like, damn, like he is doing something. They are doing something. So I totally get it, and I love it, right? And I think that's why I wanted to bring it up because I wanted to show the audience like this is how you work together. This is, you know, and like I'm not sitting here, Gala, saying that you have any of the thoughts that anybody else does. I think we're all in alignment here. But when we come to this table, it's like I accept all kinds of things in my life that I don't partake in and understand it. Doesn't mean I'm part of that culture, right? Like, but I get it. You know, I understand why they exist and why they do this. The music my daughter listens to makes me want to jump out of a car, right? But like when we're in the car, I try to be positive about it, right? Like so you can accept something that you don't like, or most people, and I know I'm on a soapbox here, I'm gonna jump off in a second. Most people they don't hate guns. They think they hate guns. They just don't want to see people die, right? And what I'm here to do is to kind of bring them back to some sense of, okay, that's not going to work. And I get why I validate their feeling, right? Like, yeah, I don't want to see people die either, right? Like I remember talking at a Moms Demand Action event. They brought me to San Jose State to speak, and I was standing in front of the gun violence sign. And I was like, when did we let that side just own gun violence? Like nobody likes gun violence, right? Like a sign that says gun violence to me is the same as like, I don't want to see puppies killed. Nobody wants to see puppies killed. Like there's not one gun person that wants to see gun violence. But I'm gonna jump off now. But I think it's just special. I love the relationship you guys have. And like I said, once again, I'm going to draw the parallel to the WTTA, the work we do. It's like we're out there, we're bridging gaps, we're making it happen.
That's what we have to do. You know, we have to be that voice. We have to have the conversations. Two of my aunts are very left wing, right, and would never own a firearm. Like I don't, neither one of them I don't think has ever touched a firearm. But yet they'll call me and say, "Hey, how's the business doing? How's this going?" And they know everything that I do, including the Armory Project. And the only thing they like that I do is the Armory Project, but they care about me and my family, so they'll be concerned about the rest. But that's the common ground, you know. And regardless of how you look at the situation, there is always a common ground. And there are too many times when we think, look, we have to be the brick wall that everyone runs against. And an immovable object will always meet an immovable force. Something's going to give. And both of you walk away battered and bruised. I'm not saying give up ground on the 2A side. I'm tired of giving up ground on the 2A side. But I'm saying we have to have conversations, or at least be open to having conversations about making a difference. And that's what you're about. That's what Walk the Talk's about. You're tired of lip service. You're tired of people saying, well, let's do this, and then nothing happens. And I'm tired of the same thing. And that's why I do my I am somebody, I am someone, because if no one else is going to be the person, I will.
I want to be respectful of everybody's time. I think we're up against it right now. Kenny, you have not said a word, and you are one of the most insightful. I feel like Jay and Silent Bob here. Like,
I was just taking it all in. I don't know how much I can actually add to the discussion.
I've been trying to get Kenny to get his own show, believe it or not, like for years, because every time he's on as a guest, he says some great stuff. But I guess, what is your takeaway, Kenny, as someone who's just been listening?
I've been stuck on the metrics concept since it was mentioned. I have this recurring thought about what Caleb said about how you can look at the data and kind of read whatever you want into it. But I find it interesting that you can do that with the metric of success, of where you go that clearly the number of firearms, or the number of storage, active storages that have taken place is a clear metric, but it's not the metric that people could read into it, or some people would read into it, because the metric isn't the number of guns. The metric is the number of times that the choice to use the program is the metric, like that. So I've just been stuck on that thought for the longest time, is that that is, I mean, how do you reconcile that? Like, is that a way that you use that to get your point across in terms of how successful it is? Or is that, I don't even know if there's a question there. I'm circling around that idea.
I mean, I can answer from my perspective, and then like Caleb from his. I think why I brought that up was that kind of two things. One is that idea that I think Caleb touched upon, which is that, I mean, we do have firearm retailers who are in the Armory Project who have not stored a firearm for anyone. And I think that I often say to them, like, you're still very successful in what you're doing. You know, there are firearm retailers who are not high traffic places, or for whatever reason, they just haven't stored anybody's firearms yet. And they may never store anybody's firearms. But that doesn't mean they're not successful in what they're doing, because they went through training, they let their staff go through training, they learned about mental health, firearms, preventing firearm suicide. We know from our training that it does kind of, it increases the knowledge and sort of confidence on the part of the staff to have these conversations with their customers. These retailers have all these materials up in their store. So if you think about going into a gun store and seeing a poster and brochures and tabletop signs and things like that bring up, just like you all do, that's part of your mission with Walk the Talk America, is like, you're trying to get this messaging into gun stores so that people are thinking about mental health and firearms and suicide prevention in the spaces where it matters most, you know, where they're going to be thinking about it and it's relevant. So those are all measures of success. But when you get asked, like, let's say by a newspaper reporter about a program like the Armory Project, one of the things they always ask is how many firearms have been stored, or how many people have stored firearms through the program. And when you answer a number, like I'm just going to make up, I mean, again, Caleb's storing a lot of firearms for people and has done so. And he stores large collections for people. And so he's kind of like a little bit of an outlier. So if you think of some of the other retailers who are going to answer zero, I've stored zero firearms. Or when you put it together all the retailers we've been working with, and the answer is like, well, there's been like 50 people who have stored firearms. And then you look at the cost of a program. I think that it's like the bean counters are going to kind of say, well, is that success? Like if you don't have a ton of events where somebody's storing firearms, like is that success or is that worth the money? And I would just argue like that's not the right metric to be using.
Yeah,
And
sure.
we have to come up with some better measures of like how do we measure changing attitudes? How do we measure? I remember Caleb, somebody in when I was doing interviews with your staff, they said we're having all these conversations about mental health and suicide that we never had before. And it's like really normalized in the store. And we're talking about it with our customers in ways that we never did before. Like that was the feedback they were giving me, which is qualitative data and it's powerful. The power of stories is really important, but a lot of people are often looking for numbers as well. So that would kind of be my answer. What's yours, Caleb?
So I've never had someone use the project twice. I haven't had that yet. I know that for a fact. And I could sit down and look at numbers of how many people. I know right now I have over 100 firearms, but that's not how I measure the success. If you asked, it was Thomas Edison, if you asked him how to make a light bulb, he said, I can tell you 999 ways not to make one. And I know that there was one firearm that I wish I'd stored. I had a father and son talk to me about the project, and the son was a veteran and they wanted to use it. We talked, had the conversation on the phone. They were going to come in. The next week, the father came in and he sold the firearm. They had gotten it back from evidence already. They didn't get it to me in time. And that's the metric that I care about, right? Because Christ left the 99 for the one. I'm already helping the 99. I want to help that one. I want to be there for that because I wasn't. So that's the metric that I go after.
Yeah, man, that's super powerful. That's I never thought about it that way, but that's yeah. I always say, like, especially because our work is very popular with researchers, right? Like I think they're fascinated by that, epidemiologists and people like that. And they're always talking about data. And Dr. Emmy Batts out of Colorado, like we have this running joke where I always like look at her and I go, "Don't let data get in the way of saving lives," right? Like it's a goofy little thing to say, but like it's true, right? And because I work with a lot of people that do not trust and have that whole like narrative beaten into their head that mental health people are trying to take your guns and this will get you on lists. It's real important to stay anonymous. Like our mental health screenings are free and anonymous, right? The anonymous being the most important part. But when they ask me like, how many people has this helped? I can only default to anecdotal stories. And I remember one time, so most of the listeners know this, but the first 2 years of Walk Talk America, I didn't take a salary. I sold my company in 2018, and I didn't take a salary until 2020. And then my first salary, going from a high-level executive at a major importer, I was making $25,000 a year. I remember I was laughing and I was joking around, and I was at one point I got super frustrated, and I was talking to my wife and I said, I don't know what I'm doing. Like, I can't, this is not fair to like our kids. This is not fair to you. Like, I'm burning through our savings, like literally, to try to make this happen. And, I hadn't gotten the big companies necessarily on board with the cash, right? Like I was getting them involved in mental health stuff. And I remember like that day, she was just like, "You're good at this. I'm like, stick with it. Like, look what you've done." She's getting me back to the positive things and all the things that you accomplished, right? But I remember and I'm not going to share the exact story because the person asked me not to. But somebody emailed and said, "I want to tell you a story, but I need to talk to you about it. Right. And they called and they shared this story. And I remember it like snapped me. I was just like, I don't care about data. Like, you know what I mean? Like, this is all I needed to hear, that we're having this impact. And not everyone's going to reach out and tell you. Like I tell people all the time, like people don't, when they go through crisis and they come out of it, sometimes they're embarrassed by what happened. They're not necessarily going to be like, Caleb, I just want you to know, dude, you changed my life. Like they may just keep it moving, and we don't care. We want them to keep it moving. Like that's exactly, you don't need to tell us like we're doing great things or we help. Like we just want to make sure you're okay. And, I'm horrible at it. Like so many people like email and they share these stories, and I never even think to be like, can I use this as a testimonial? You know what I'm saying? Like because I don't, my brain is not wired like that. My brain is not to go into the room and tell you how great everything that we're doing is. But I think our work, I know people are going to want data, especially if they're putting money behind it. But like, I need people to see beyond just that. You know what I mean? It's like shadow me for a month.
Yeah.
Like, walk into a room with me in a gun industry event, and watch how many people stop and say, dude, everything you're doing, man, we've been following you. Like, you know what I mean? Yeah, we want to be involved in getting the cards of the boxes of the guns. I mean, Kenny, like you've seen manufacturers come around. Some of these people 6-7 years ago, there's no way they would talk about it. So I only applaud, like, once again, like the work you're doing. How many years has this been going on in Louisiana?
Caleb, you started on your own.
We've been in business for just over 5 years, and this probably happened within my first 9 months of opening that we were doing this.
Okay.
And then
the actual
our formal, the Armory Project started, I think 2021. So it's not that long. And we have 15 retailers across the state now, and we're working on expanding to Arkansas. And that's, I think one thing I'll say, because I always say, again, with the numbers, Caleb and I talk about this a lot. Our goal is not to have every FFL in Louisiana on a map. Our goal is to have coverage of as many FFLs that are really committed, where their staff are highly trained, and we're in touch with them monthly so that we know that they're kind of still offering the program, have the support they need to offer it, and to have somebody to be able to get to a retailer in time to get help. But to have that real quality and to maintain that quality and those relationships rather than just having like a lot of locations. And so that goes back to the numbers thing, like I think Caleb said to me once, like, if you're going to drill wells for water, you could drill 30 wells, and if none of them give much water, that's not as good as one well that gives a lot of water. So I'd rather have like one Caleb, or 15 or 20 places similar to Caleb than to have every single FFL in Louisiana on the map.
Yeah, that makes complete sense.
It's interesting too, Mike. I wanted to touch on something you talked about in relation to the anonymity, but also the ability to move on past someone's crisis. I think the concept you're circling around is the idea of keeping someone's dignity through the crisis, because that's the hardest part. That's what people are afraid of. I think what people are afraid of is to be seen differently, or to feel, to be seen as weak, or to whatever that is, and it's them, losing their dignity, so to speak, in terms of being able to handle a crisis. And I think that's interesting to tie into how Caleb has figured out the ways in which the program works as it relates to the ATF. It's interesting that, like, with the gunsmithing and repair and cleaning service, it's perfect because while they can have the conversations they need to have with you, they're a customer. You know what I mean? So you're allowing them to keep functioning as a normal human being, and allowing them to keep their dignity while working through the crisis. And I think that's awesome. Without, and to be, I'll caveat that a little bit with, people can harp on the fact that capitalism or consumerism can be cold. That's not what we're talking about. It's compassionate capitalism that you're engaging in.
I remember one of the interviews I had with the VA when I left active duty service, and I'm sitting down talking to this woman, and she's like, "Well, have you ever thought about hurting yourself?" Yeah. "You ever thought about hurting others?" Yeah. And she just stops and she goes, "Well, that's not normal." I'm like, "Well, who do you hang around with? Because every person I hang out with, like, we want to punch people in the face every day of the week, you know?" And it blew my mind whenever that's not normal. What's normal?
What's normal?
When we go back and we look at history, what was normal 100 years ago isn't normal today. And what's normal tomorrow won't be normal today. If normal is going through life with no feeling and no emotion, then I am not normal. Not at all.
And I think that actually ties into the language thing that Gala was talking about early on, is finding the right language so that we know what we're talking about, but it can bend to what everybody's understanding of what that is. What is security? I know what safety is because it's what I define for myself. So I think that's a cool insight that ties all that back together too.
Yeah. I'm gonna wrap this up just because we've gone an hour and a half. But this conversation, to me, like, I could just sit and talk to you two all day long. Like, that's, you know what I mean? It's like, I don't want it to end, but why don't you tell?
You live here now, guys.
Yeah, Kenny, welcome to the show. Kenny's a soul starter. He's more like a relief pitcher.
That's right. I had to get all this Diet Coke in me before I started off.
No, for anybody out there that's listening, whether it's a gun shop or someone who's curious about firearms, or wants to be involved in some way or promote the project, how do they get a hold of you?
Well, I can say the website for the Armory Project is www.armoryproject.org. And that is, we'll have a lot of information about the Armory Project. It has our toolkit that we share with people, which has like tools they can use if they want to do something like this. It has our map. When we have a map in Arkansas, that will be up there. And people can also email me. I would probably use my LSU email. It's jtrue, JTRUE at lsuhsc.edu. With any questions. And then Caleb.
Yeah,
Poor Caleb doesn't need to get inundated with phone calls.
After some of the interviews we did with I don't remember who all I interviewed with now. The contacts just came pouring in. But if people have questions about getting involved or what it's like being involved with it, my shop's called The Rustic Renegade, and they can reach out to us at sales@therusticrenegade.com. Or if they want to hear the other side of it, the podcast I do, it's implicitbiasradio.com, and you get the contact on us on there as well. Ask me questions. I may not respond right away, but ask me questions. Okay.
And I like to end this with one question for both of you. I may have opened up more talk, but and Gail, you start. Caleb, you end it. How do you tend to your mental health?
Ooh, that's a great question. I thought we were wrapping up. I try to exercise, be outside, go for walks, be in nature. It really helps a lot to work with people like Caleb. I really have strong relationships, I think, or at least I try to, as much as there's time, with the people that I work with. And I try to focus on whose opinions I care about. Like I don't worry about what people think of me unless it's somebody who I really have a lot of respect for. And so just kind of like check in with myself at the end of the day, do I think I did what I needed to do to be able to put my head down at night and sleep? I think those are the main things for me. I love scuba diving. I haven't been in a while, and I'm jealous. Caleb goes and he flaunts it. He tells me he's on a diving trip, and I'm like, all right, I got to go do that soon. Caleb, what about you?
I don't work out near as much as I should. I enjoy working out, but I shoot, man. I shoot every week. I'm involved with faith. I lead a men's Bible study, and I have the right kind of friends that I can be open and honest with. That's really what it is. Is I'm open and honest with my friends, and they are brutally honest with me. They'll call me out and tell me when I'm not acting like myself, and they'll open me up until I want to cry. So
Well, I love both those answers. There's never a right one. It's always interesting to see people when they're throwing that curveball at the end of the show, and every answer is great. So I love it. And on that note, on behalf of our sponsors, I'd like to thank Lipsy's. I'd like to thank Ruger. I'd like to thank Arms Corps, USCCA, all the people that make this show possible. Chattanooga Shooting Supplies. Uh, Thank you for coming on the show. I think this is a fascinating conversation, and I hope the audience really, really listens to everything that we're talking about and keep promoting better mental health and guns. Guns and mental health is not mutually exclusive, right? They can go together. Times are changing, and if you're a firearms person, I want you to be very proud of the work that the industry is doing. I think it's amazing work, and it's a cultural shift. This didn't happen 7 years ago. It didn't exist. I always say it's like talking about an F5, the movie Twister, right? Like with the tornado things. Like we don't talk about an F5. We don't talk about suicide. We don't talk about mental health. Now we do, right? And I just want to wish everybody better mental wellness and stay on top of your game. And thank you.
Thanks, you guys. Thanks for the opportunity.
thank
Really
y'all and God
appreciate
bless.
everything you do.